In 2015, 5 agencies contracted with the Kansas Department for Aging and Disability Services to form the Kansas Prevention Collaborative, a partnership dedicated to helping communities across Kansas tackle substance abuse, suicide, and problem gambling through the provision of prevention, education, awareness, and advocacy. In 2016, the collaborative worked together to accomplish some amazing things in Kansas. The Kansas Department for Aging and Disability Services Prevention and Promotion Services team spearheads the collaborative. Quedas manage the collaboration among all of the contractors. Contractors are committed to shared responsibility for developing support systems, resources, connections, and aligned processes to support Kansas communities as they seek to improve the behavioral health of their communities. Throughout 2016, KDADS was able to substantially increase the number of communities who received grant funding to address behavioral health concerns, as well as build and strengthen relationships with communities as part of their new cooperative grant process. KDADS also worked together with communities and contract partners to increase the knowledge around shared risk and protective factors and awareness of suicide prevention efforts. They also worked to expand knowledge of problem gambling and adverse childhood experiences throughout the state. By integrating our efforts, we've been able to develop a more comprehensive approach to prevention. KDADS worked diligently to develop the Prevention Subcommittee under the Governor's Behavioral Health Planning Council. This group of dedicated volunteers will help enhance the integration of prevention efforts and is already preparing for the development of a comprehensive behavioral health prevention plan. In 2016, KDADS also began working with the Partnership for Success 2015 prescription drug pilot to re-engage the statewide prescription drug work group and helped create a plan for decreasing the misuse and abuse of prescription drugs in Kansas. The first contractor on the list, Dekha, provides training and technical assistance for community coalitions as part of the Kansas Prevention Collaborative. Dekha's 5 community support specialists deployed across the state work closely with more than 40 community coalitions by providing technical assistance and support. Dekha developed and published online training modules available for communities to utilize. The modules provided training on the phases of the Strategic Prevention Framework, the Kansas Communities That Care Student Survey, and suicide prevention. In addition, Dekha developed and published 14 online toolkits to assist community coalitions in successfully completing their prevention work. They provide comprehensive information on topics like conducting effective meetings, writing vision and mission statements, and more. 2016 also provided Dekha the opportunity to sponsor the attendance of 31 coalition members at the Community Anti-Drug Coalitions of America Mid-Year Training Conference. The conference provided an opportunity for learning and collaboration, and coalition members came back better equipped to do prevention work in their communities. With the PFS grant from KDADS, Dekha identified and funded 4 pilot projects addressing prescription drug misuse and abuse across Kansas. Dekha also reconvened the statewide prescription drug prevention work group and is in the process of developing a strategic plan to address this issue in Kansas. Our next contractor, Greenbush, was also very busy in 2016. They developed and launched a brand new online resource called the Kansas Behavioral Health Indicators Dashboard, or KB-HID. This resource provides county-level data on dozens of behavioral health indicators, including measures of poverty, crime, adult and youth substance abuse, and mental health. This is the first of its kind in Kansas. For the first time in Kansas, 82 school districts are systematically tracking rates of youth depression and suicidal thoughts, plans, and attempts through a new optional set of questions on the Kansas Communities That Care Student Survey. Greenbush has also been working diligently on a newly developed survey for young adults ages 18 to 25 that will provide valuable behavioral health data on a population that is often overlooked and difficult to reach. In collaboration with KDADS and the KU Work Group, Greenbush presented evidence of Kansas's success in substance misuse prevention. They discussed enhancing the capacity of community coalitions to support evidence-based strategies through the Partnership for Success initiative. This collaboration is a great example of one of the many ways Kansas Prevention Collaborative partners support one another and communities with their work. Also, thanks to Greenbush's tireless work, participation in the Kansas Communities That Care Student Survey rebounded from 35,000 in 2015 to 55,374 in 2016 via extensive efforts to help schools and communities navigate the requirements of the Student Data Privacy Act. Keys for Networking, Inc. filled the invaluable role of advocating for and supporting families throughout 2016. Keys expanded peer-to-peer support for parents of children with serious emotional disabilities to include substance abuse prevention and treatment information. They also successfully provided intensive information, support, and advocacy for over 500 parents and 25 youth who requested one-on-one help securing services from multiple agencies. 87% of these young people remained at home with their families and in their schools. Keys developed a statewide network of volunteer parent peer-to-peer mentors to provide information and support at the community level that includes 75 parents. Through their unique online platform, Keys also provided information to 144,000 people via Facebook, Twitter, email campaigns, and their website. In 2016, Keys also provided direction for the National Federation of Families for Children's Mental Health in Rockville, Maryland. Their support was used to refine the competencies of practice for parent peer support specialists and develop the capacity to deliver a national training curriculum that improves parent peer provider skills to mentor parents, secure services in sufficient quality and quantity, provide positive child behavior supports to manage children and adolescents with severe behavioral challenges, and negotiate with providers and monitor child outcomes to assure positive change. As part of the Kansas Prevention Collaborative, they advocated for children and their parents on the board of the Kansas Mental Health Coalition, the Governor's Behavioral Health Services Planning Council and its executive committee, and as a member of the Children's Subcommittee. Keys also addressed the needs of minority families with the development of a curriculum to provide Kansas parents guidance to improve state and local services. The curriculum was comprised of 2 modules designed to identify levels of cultural bias in educational and behavioral health practices and secure services and supports that meet the cultural identity and needs of the child and family. They also worked with the American Institute for Research and National Wraparound Initiative on a publication highlighting the effectiveness of Keys' targeted parent support in reducing out-of-home placement for Kansas juvenile offenders. The University of Kansas Work Group for Community Health and Development worked in conjunction with Greenbush to take care of the data and research needs of the prevention community. The Community Checkbox has supported KDAD's grantees for more than 20 years. The Community Checkbox has evolved and been enhanced to support online data collection for each of the KDAD's initiatives, including KPC, PFS 2015, KPC contractors, and Prevention Works. The KPC Workstation Collaboratory is the community hub that has been developed to support online communication and collaboration between KDAD's contractors and grantees. Document sharing, discussion board communications, and contract reporting are among the various ways the Communication Hub supports the work of Community Coalition grantees. As part of the evaluation team, the KU Work Group provided a presentation with KDADs in Greenbush at the National Prevention Network 2016 conference featuring the Partnership for Success initiative. Annually, data that has been recorded into the Community Checkbox evaluation system by grantees and then scored by KU Work Group supports federal reporting for the National Outcome Measures Report. 6,581 accomplishments were documented in the Community Checkbox by coalitions from 2015 to 2016, which were then reviewed by the KU Work Group to support KDADs and coalitions in understanding the implementation of prevention activities and processes in communities. The Kansas State Organization of the National Alliance on Mental Illness also did great work this year as part of the Kansas Prevention Collaborative. NAMI Kansas completed 2 training events for new family-to-family teachers. Family to Family is a 12-week education program for family members of a person living with mental illness. 201 participants completed Family to Family in 2016 and 20 new leaders were trained. They also completed 1 training event for new NAMI Basics leaders. NAMI Basics is a 6-week education program for parents and caregivers of a child with a diagnosis or symptoms of a mental illness. 24 people completed the Basics class and 8 new leaders were trained. In 2016, NAMI Kansas trained 15 new presenters for In Our Own Voice. These presentations are available to the general public with messages about destigmatizing mental illness and hope for recovery. There were 20 In Our Own Voice presentations in 2016 and 645 individuals were reached. In order to reach middle and high school students, NAMI Kansas also launched the Ending the Silence program. It includes a 15-minute presentation on the reality of living with mental illness and how to get help. This program is reducing stigma and providing powerful role models for young people. In collaboration with Greenbush, NAMI Kansas designed evaluation data systems for all education programs, the CIT Summit, and the NAMI Kansas Annual Conference, as well as upgraded their data collection system for NAMI Kansas resource line calls. The final contractor in the Kansas Prevention Collaborative is Wichita State University's Community Engagement Institute. In 2016, WSU coordinated much of the statewide tour wherein the new prevention infrastructure was introduced. They created and implemented Prevention Works, a statewide prevention coalition of coalitions that meets quarterly. They also created and implemented Prevention Talks, a prevention-focused monthly virtual learning collaborative that gives coalitions the opportunity to learn from one another. WSU created and implemented the Kansas Prevention Collaborative website, which is now used to share priority prevention topics and research, behavioral health resources, destigmatizing and empathy-building content, and contact information for coalitions across the state in a way that has not been done before. In the 8 months since its launch, the website has accumulated over 19,000 page views. In conjunction with the website, WSU created and maintained a Kansas Prevention Collaborative Facebook page. It connected people across the state and aided in communication of messages and information in ways that are consistent. This social media platform provided stigma-reducing messages, access to resources, prevention news, relevant opportunities for coalitions, and reached over 103,000 people. Finally, WSU coordinated with Kansas Prevention Collaborative Partners, Headquarters Inc., and Quedas for National Suicide Prevention Awareness Week. This included the proclamation signed by the governor, as well as the design, filming, editing, and release of the suicide prevention PSA, HOPE. This video generated significant awareness related to suicide prevention and the Kansas Prevention Collaborative, including reaching over 8,000 people and generating over 350 reactions in a single day. Thanks to the efforts of all these partners, community coalitions across Kansas were able to do important work in their communities. Here are a few examples. Rossville Safe Streets filmed a PSA with Gizmo Pictures. It included 50 students and 12 parents. They also secured the rights to control signage for the Rossville Tall Corn Festival so that alcohol advertisements would no longer be present on the banners. They conducted a Power of Parents workshop and educated parents on ways to talk to their children about underage drinking. The Shawnee County Substance Abuse Task Force Marijuana Education Team presented the marijuana quiz, What's the 411 on 420, at an in-service training to 21 paraprofessionals at USD 501, as well as to 98 8th graders at French Middle School. This quiz serves to debunk myths surrounding marijuana use. The Sumner County Community Drug Action Team hosted and organized Crusader Night, an event that reached 250 youth. They also partnered with schools to put on the School Unity Project, promoting unity among students and preventing drug and alcohol use. They also organized a town hall meeting in Wellington for all Sumner County communities and leaders, in which Greenbush gave a presentation on the Kansas Communities That Care Student Survey and its importance. Live Well, Live Atchison utilized all the tools designed by the KU Work Group to submit their progress reports, fiscal reports, and all supplemental information. They also completed their PFS 2015 planning process. The Manhattan Area Risk Prevention Coalition worked to establish a formal partnership with Fort Riley Military Base. Military personnel assisted with sticker shock in the community, and they displayed It Matters materials on base. The Morris County Anti-Drug Task Force supported the Morris County Health Fair. The 300 people who visited their display were given information about substance abuse and available resources. They also placed information in the local newspaper and reached nearly 600 people as a result. Through a transition period, the coalition was also able to maintain consistent meetings and communication with stakeholders. Shawnee Safe Streets presented the Power of Parents workshop in both English and Spanish via Facebook for the first time. The Spanish page reached 3,319 people, and the English page reached 2,135 people. They also partnered with a Latin radio station to present Power of Parents in Spanish and began a radio show called Calles Seguras, un servicio para la comunidad, or Safe Streets, a service to the community, which is being used to educate and keep the community informed of upcoming events. Thanks to the passion and dedication of the Kansas Prevention Collaborative partners, Kansas coalitions are better equipped to serve their communities and build a brighter future for our state. The collaborative will tackle each of 2017's new opportunities for promotion, education, awareness, and advocacy with the same passion and dedication. Thank you for this opportunity to serve our state's prevention efforts.